Good evening and thanks for joining us. We begin with the outbreak of COVID-19 and what you need to know about its spread. The numbers keep changing and so does the advice about travel. With March break around the corner, we know many Canadians are wondering about their plans. Here's where things stand right now. Canadians are being advised to avoid all non-essential travel to parts of northern Italy. That includes Venice and Milan. That same strict warning is in place for all of China and all of Iran, plus 2 cities in the southeast of South Korea where outbreaks have occurred. Canadians are being told to exercise a high degree of caution in other parts of South Korea and in Japan. And starting today, anyone who arrives in Canada from Iran is being asked to self-isolate and monitor themselves for symptoms. The World Health Organization says there are now 9 times more new cases outside China than inside China. The virus has been detected in more than 60 countries, including Senegal, Tunisia, Jordan, and Iceland. Though it's important to note, many of those countries have only 1 or 2 cases. Interrupting the spread is the goal of public health experts. Some infectious disease specialists say that's no longer possible because it appears the virus can be spread by people who have no symptoms. But the World Health Organization is urging countries to put containment measures in place.
We are still hopeful that containment is the right first strategy. But clearly, containment with the purpose of slowing down the virus. And if we're lucky and if we do the job really well, we may get the opportunity. We just might get the opportunity to interrupt transmission.
Here in Canada, there are now 27 confirmed cases after 3 more positive tests in Ontario. All the Canadian cases are believed to be linked to travel. There's still no evidence of community transmission. But in the U.S., that is no longer the case. People appear to be contracting the virus in the community from people who have not traveled to countries where there's an outbreak. In Washington state, that's just across the border from B.C., 6 people have now died. And authorities are preparing for that number to rise because it's believed the virus may have been circulating there undetected for weeks. Abigail Bimman has tonight's top story.
A germ-minimizing elbow bump greeting as health officials across the U.S. focus on reducing the spread of the new coronavirus. It's spreading to new states, with the first cases in Rhode Island, Florida.
The first patient's an adult resident in Manatee County without travel history to China or other countries identified for restricted travel by the CDC.
And New York.
We are fully coordinated. We are fully mobilized.
New York's governor stresses the key is reducing the spread. Elimination is impossible. Andrew Cuomo promising new bleach cleaning protocols in schools and on public transportation, and more than 1,000 devoted hospital beds.
We want 1,000 tests per day. Test as many as you can, and then isolate those people.
Federal officials are promising more test kits, everyone bracing for a further spike in cases, in part because of increased testing. And nationally, the spotlight is really on Washington state, with at least 6 deaths and an increase in cases at this nursing home.
The risk for all of us of becoming infected will be increasing. And although most of the cases will be mild or moderate, the infection can cause serious illness, and there's a potential for many people to become ill at the same time.
In Texas, there's frustration with federal authorities after a woman who traveled there from Wuhan, China, was released from quarantine after testing negative twice, and then brought back into isolation after a 3rd test came back positive.
We simply cannot have a screw-up like this from our federal partners.
I know that my husband's testing this morning, so we're praying for a negative tonight.
These women are leaving quarantine in Nebraska, but leaving their husbands behind for now. The men tested positive after being aboard the Diamond Princess cruise ship, which docked in Japan. This pair now has new fears about going home.
Will my friends shun me when we go back, or just the community in particular? Will they shun us, be afraid of us?
With the new coronavirus increasingly on everyone's minds as it continues to spread. This afternoon, U.S. President Donald Trump and his coronavirus task force met with pharmaceutical executives. The president saying everyone's goal is to accelerate the development of a coronavirus vaccine. He also said he's eyeing new travel restrictions, but didn't offer any details. Donna?
Okay, Abigail Bimman in Washington, thank you.